Hi everyone, good afternoon and welcome back to my YouTube channel. Thank you again for tuning in to this YouTube channel. If you're new here, please subscribe to this channel. I come every so often with different educational material. So today I wanted to bring to you a few questions on the CNA, Certified Nursing Assistant Prometric exam. So I have a template here that I'm going to be reading these questions to you, and I will be providing you with the appropriate answer. So if you're new here, welcome to this channel, welcome to this family, and please subscribe. So I will be looking down in my template so I can read these questions to you. Let's dive into the content. The first question I have here is that infection control is A, the way in which infection occur. B, an infection limited to specific parts of the body. C, a set of methods used to prevent the transmission of the disease. D, an object that has been contaminated with pathogens. So infection control, actually the correct answer is C. It's a set of methods that is used to prevent the spread or the transmission of infection. So C is the correct answer for that question. Let's look at another question. Question 2, the following are necessarily links in the chain of infection. When a nursing assistant wears gloves, which link is broken, thus preventing the spread of the disease? A, reservoir, place where the pathogen lives and grows. B, mode of transmission, a way for the disease to spread. C, susceptible host, person who is likely to get the disease. D, causative agent, pathogens or microorganism that causes a disease. So when a nursing assistant wears gloves, what link do you think it's broken? So B will be the correct answer, the mode of transmission, a way for the disease to spread. So by wearing the appropriate PPE, you are preventing the disease from spreading. So let's look at another question. Question 3. The following are necessary links in the chain of infection. When a nursing assistant gets a vaccination shot for hepatitis B, which link will be affected and thus prevent hepatitis B infection? A, reservoir, place where the pathogen lives and grows. Mode of transmission, a way for the disease to spread. C, susceptible host, a person who's likely to get the disease. D, portal of entry, body opening that allows pathogen to enter. So if a nursing assistant gets a vaccine, which link will be affected? So what do you think is the correct answer? C is the correct answer. Susceptible host, person who is likely to get the disease. So if you are immunocompromised and you have a weak immune system, you are considered a susceptible host. So by getting vaccinated, you are protecting your body from being in that category. So C is the correct answer. Let's look at another question here. The single most important thing you can do to prevent the spread of disease is to A, carry dirty linens close to your uniform. B, Never change your gloves. C, remove gloves before cleaning spills. D, wash your hands. So the single most important thing you can do to prevent the transmission of diseases is by proper hand washing. So according to the Center of Disease Control, we're supposed to wash our hands for approximately 15 to 20 seconds. So by washing your hands, you are minimizing the transmission of infection. So proper hand hygiene is critical. Let's look at another question. 5. The elderly are higher risk of infection because they have strong immune system. We know that's not correct. They are rarely hospitalized. C, they are always well nourished. D, they may have limited mobility. So what do you think is the correct answer for this question? So it should be D. They may have limited mobility. A lot of elderly and geriatric patients, their mobility status is not that great. So if you can get around, you're at higher risk for infection. So D is the correct answer for that question. Let's look at another question. Standard precautions should be practiced only on one people who look like they have a blood-borne disease. B, on every single person in your care. C, only on person who requests that you follow them. D, only the residents whose chart indicates they are sick. So standard precautions or universal precautions should be actually implemented or should be practiced on every single person in your care. You should be using proper infection control, using your appropriate PPE, wearing gloves, wearing masks, washing your hands. So A is the correct answer for that question. So let's look at another question. Under standard precaution, the term body fluid includes sweat. A, B, water. C, juice. D, urine. So under standard precautions, the term body fluid includes. So the correct answer is D, urine. That's considered a body fluid. So let's look at another question here. Hand hygiene means using soap and water as well as alcohol-based rubs to keep hands clean. B, using alcohol-based rubs for visibly soiled hands. C, only using alcohol-based rub to clean hands, wearing false nails. So hand hygiene means using soap and water as well as alcohol-based rub to keep hands clean. So A as in alpha is the correct answer for that question. So guys, I hope you like these few CNA nursing assistant questions. So I have quite a few that I can share with you. Let me know what you would like me to provide you with. I have different questions for the book that they're using for the certified nursing assistants. So let me know what you would like me to provide you with. So again, thank you for my subscribers who have been subscribing to this YouTube channel. Thank you so much for being a great supporter. Thank you for liking this video. Thank you for sharing this video. And if you're new here, please consider subscribing to this YouTube channel, like and share, and drop your comments below. And please give me a thumbs up. Thank you so much. Have a great day, and I'm out. Thank you for watching. Bye.